Welcome back to another edition of Your Health with MU Health, and this is segment number 2 with Dr. Christelle Ilboudo, last week we were talking a little bit about ticks and mosquito bites. This time I think we want to kind of dive into the measles. Have we seen any cases of the measles in Missouri so far this year, or is it expected to come?
We've seen one case of measles in Missouri so far with the current outbreak, but there's always a potential that we could see more.
What causes measles, and what do you do to get rid of those?
Measles is caused by a very contagious virus. The reason why we have so many cases is that it only takes a few particles of the virus for somebody to be infected, and they don't necessarily have to have close contact. One of the examples that I give is, for example, if you are getting to an elevator and prior to that there was somebody with measles who happened to sneeze or cough in the elevator, just the simple fact of sharing that small space, even though the person was gone, that the next person who enters the elevator who is susceptible to measles can easily get it. So it's very, very contagious. About 80% to 90% of people who are susceptible to it when they get exposed actually do get the disease.
Is there any certain age group that's more susceptible to measles? Do children, are they more prevalent, or folks who have a weakened immune system?
Generally, the people who are not immunized and who have not had measles in the past are the ones who are more likely to get it when they get exposed. We think of children in particular just because children tend to be in those more crowded environments, tend to play together, share a lot together. So it's easier to spread measles in a children group than it is in an adult group. But anybody who hasn't been previously immune to it, either via vaccination or having the disease, is at risk for getting measles.
When should they get those vaccinations? When do you recommend that?
So for children, we recommended, it's part of the series that they get the first dose at a year of age and then the next dose between 4 and 6 years of age. For adults who have never been immunized, we recommend getting 1 dose at least, unless they can recall having measles when they're little. But those adults I think are few that remember having measles when they're little.
Can measles be deadly?
Yes, absolutely. It can cause infection in almost every organ system, including the brain. And so we've seen some cases where they get infection around the brain and they can succumb from it, or they get really severe infection in the bloodstream and they can die from that too. So yes, we have seen some cases.
Is there any more time of the year that's prevalent for measles, or is it a constant threat?
It's a constant threat depending on, exposure. Basically, it comes from someone else who has the measles. And so we've seen some summer outbreaks in people who go to amusement parks or parks where there could be a case there. And so crowded environment again with a case, people get easily exposed. We've seen it with international traveling, which is probably the highest exposure that we have in the U.S. If somebody going to another country and then bringing measles back and exposing, people along the way with that.
So the recommendation to keep away, to kind of protect yourself from this is to get vaccinated, correct?
Yes, absolutely. The vaccine is 96% to 99% effective with just 1 dose. We catch up the other 3% of people who may not respond to the first dose by giving them the second dose. So the vaccine is very effective against measles.
Well, I want to thank you for your time and stopping by with us for 2 weeks in a row, talking about tick and mosquito-borne illnesses and the measles as well. Thank you so much.
Thank you.
This has been Dr. Christelle Ilboudo with MU Healthcare on Your Health with MU Healthcare on AM 1340 KXEO.